On the Medical Watch, a red flag for depression.
Medical reporter Dina Baer has more on a potential new tool in the fight for better mental health.
About 30% of patients do not get better by taking antidepressants. But why? Local researchers are looking in the blood for answers, not just to diagnose the disease, but to help determine if medications are working properly.
You can tell from this grain here, I've been doing this a long time.
It's been neuroscientist Mark Resnick's life's work. After 40 years, a breakthrough in a tube of blood.
About half of the people who are depressed don't seek treatment. And the reason that they don't seek treatment is there's a lot of stigma on depression. This is a social justice issue. And now we can say, well, you know, it's not just in your head, it's in your blood.
What the UIC distinguished professor and his team found in the platelets of patients with depression, a protein stuck in its tracks.
And we've developed this system looking at a particular protein and how it either gets stuck when you're depressed or liberated when you're treated correctly.
It's called a G protein, and it sits in the membrane of a platelet or nerve cell. Its job is to relay messages from hormones and neurotransmitters, like serotonin and epinephrine, to the inside of the cell. In a small proof-of-concept study, Dr. Resnick and his team looked at blood samples from patients taking the same amount of antidepressant medication. In those who improved, the G protein broke free. In those who didn't improve, it remained stuck in the cell membrane, unable to convey the neurotransmitter signal.
So what happens is if it gets stuck, it doesn't work the way it's supposed to. So when it gets unstuck, it goes to another enzyme and makes the neurotransmitter work the way that it's supposed to and the way that it would do normally if you're not depressed.
Dr. Resnick hopes his biomarker blood test will be beneficial for patients deemed treatment resistant, meaning various drugs haven't helped ease symptoms. That's because platelets turn over every week, giving clinicians an opportunity with a simple blood draw to quickly determine which drugs are working to unstick the G protein.
The idea would be that if we see in a week you're not responding, well, let's try something else, or let's add something. Let's not wait 2 months and let you suffer. I'd like to say it's my mitzvah project, which means good deed in Hebrew.
The next step is to test the blood test, called the mood mark, in a larger group of patients. The researchers also hope to experiment with medications directly on the platelets in the lab to see which ones unstick that protein. Back to you.
Well, some Illinois lawmakers